Hello everybody, Kemo Sabi here, coming at you with another video. This is off of MSM webpage, through the Canadian Press and National Post staff, posted 5 hours ago, with the topic of first Canadian coronavirus case officially confirmed, second is presumptive, 19 people under investigation. Toronto, Canada's first presumptive case of the novel coronavirus has been officially confirmed. Ontario's health officials said Monday, as they announced the patient's wife has also contracted the illness. Meanwhile, 19 cases are under investigation in the province. Dr. Barbara Yaf, the province's Associate Chief Medical Officer of Health, said the confirmation came through earlier in the days following tests at the National Microbiology Laboratory in Winnipeg. A Toronto man in his mid-50s had initially tested positive at a provincial facility days after returning to Toronto from Wuhan, the virus's epicenter in China, via Guangzhou. Yaffe said the testing process is now being repeated for the man's wife, believed to be the second coronavirus patient in the country. Her test is positive at the Ontario Public Health Laboratories, and specimens are being sent to the National Lab for final confirmation. A spokesperson for the Ministry of Health told the Post that those under investigation exhibited some of the symptoms of coronavirus, while the two presumptive cases tested positive with the provincial test. We are now awaiting the results from the federal test to see if they're confirmed cases, David Jensen wrote in an email. In many ways, this case is not surprising, said Dr. David Williams, Ontario's Chief Medical Officer of Health. This individual has been in close proximity to her husband, and having also arrived in Toronto from the area of Wuhan, could also have been exposed to the virus in China. Toronto's public health is working flat out to try to contact those passengers on the couple's January 22nd flight from Beijing, most at risk of infection, people in the 3 rows in the front and behind the pair's own seats, said Dr. Eileen De Villa, the city's medical officer of health. She said they had so far managed to reach a few of them, but did not say exactly how many passengers the department is targeting. The vast majority of the 19 people under investigation in various parts of the province have been admitted to a hospital and are in isolation, with appropriate protective measures taken around them, said Jaff. Canadian coronavirus patients showed symptoms on flight back from China, officials say. Matt Gourlay, health officials can reassure us all they want, but our system failed. Public health officials say the woman's husband, a man in his 50s, had been showing mild symptoms on his flight from Guangzhou, China, to Toronto. Upon arrival at Toronto, the man did not report to border service officers that he was feeling ill, despite detection measures at the airport, which includes screening questions at electronic border kiosks that ask about previous travel to Wuhan in the past 14 days, and remind people to report flu-like symptoms to border service agents. They've since been reaching out to those abroad in China, Southern Airlines flight, who sat within 2 meters of the man. A day after the man went home, a family member called 911 to report he was feeling ill and that he had recently traveled to Wuhan. Paramedics, donned in protective gear, took him to Sunnybrook Health Services Center, where he was immediately placed in isolation in a negative pressure room. He was listed in stable condition Saturday. Canada's Chief Public Health Officer has said she believes there will be more cases imported into Canada because of global flight patterns, but she notes there's little risk of them becoming infected here. Dr. Teresa Tam also says she expects to receive official confirmation Monday from Winnipeg's National Microbiology Lab that the man's illness is indeed the new coronavirus. The diagnosis is presumptive until that lab finds the same positive results as the test conducted in Toronto. The Toronto man has been managed with all appropriate infection and prevention control protocols, so the risk of onward spread in Canada is low, Tam said. Nevertheless, it would not be unexpected that there will be more cases imported into Canada in the near term, given global travel patterns. 9 other suspected cases in Ontario alone were under investigation as of Sunday. The news of Canada's first coronavirus patient came Saturday as authorities around the world grappled with the new type of virus, which originated in China but has since spread. Several countries, including the United States, have said they plan to evacuate diplomats and visitors from Wuhan, the virus's epicenter. Foreign Affairs Minister François-Philippe Champagne said in a statement Sunday that Canada doesn't have a diplomatic presence in Wuhan, but he noted the government is in contact with and providing assistance to Canadians in the area. China is reporting 2,744 cases and 81 deaths, but it remains to be seen whether the virus is as dangerous as the common flu, which kills thousands every year in Canada alone. A top Chinese health official warned on Sunday that the virus's spread was accelerating despite a lockdown affecting 56 million people. The quarantine could make the situation worse, including by exacerbating shortages of medical supplies. Most of the 2,744 people who have contracted the virus live in China, but it has spread to 10 other countries. 5 cases have been confirmed in the U.S. Canadian doctors are urging concerned citizens to take the same sorts of precautions they would to avoid common illnesses, such as frequent hand washing and coughing into the arm or sleeve rather than the hand. They also say that wearing surgical masks during everyday life has little use in protecting against coronavirus. Despite being effective in hospital settings, early data on the new form of virus suggests masks won't be especially effective, and some say that repeatedly touching and adjusting the mask with unwashed hands could do more harm than good. But the fear that would prompt someone to buy such a mask is perhaps heightened by parallels to the 2002 SARS outbreak that originated in China and infected more than 8,000 people, killing 800. There were 44 Canadians killed by that strain of coronavirus. Hope you enjoyed the write-up, everybody. It'd be awesome if you leave me with some comments. Great if you subscribe and hit the bell. Kemo, Sabi out. We'll see you all in the next one, everybody. Thanks a lot. Bye.